I am from New Orleans originally, technically Kenner, which is a special part of New Orleans, frequently known as Kenner City. I trained in medical school went to medical school at LSU in New Orleans, and then I trained at Earl K. Long here in Baton Rouge, which held a very special place in my heart. I finished all 3 years there and then did a chief year at Our Lady of the Lake with LSU Internal Medicine in Baton Rouge. I had met before with some of the physicians here and was in between doing academic medicine or more staying with LSU or doing private practice. And I enjoyed teaching, I enjoyed seeing people figuring out how to go about diagnosing and treating people, but I missed doing that myself. I missed being that first step person. And so I had kind of called up the clinic and came over here. And I had come here previously back when I was in college, and it was an easy place to deal with as a patient, so it was easy to kind of do as a physician as well. When I am not being a doctor, I really enjoy football, lots of tailgating. So we have a very large LSU tailgate crew, which I enjoy very much. And then we have season Saints tickets up in the nosebleeds with our Saints family, which is a whole different crew. I have one sister, and she has a brand new daughter who is gorgeous. She takes up all of my time when I'm around her. And then hanging out with family, eating good food, which Baton Rouge has a lot of. I do a good bit of gardening. I'm not a good gardener, but I try really, really hard. The relationships with my patients are very important to my life. I have kind of adopted them all as some form of family. And usually when I go through my treatment, I say, you know, if you were my father, if you were my grandfather, this is what I would want you to do. This is what I would want you to know about your disease process so that you could better understand what you have to do to treat it. Some of the good days are also some of the hardest. So I have had patients that I've helped make very difficult decisions for their long-term care. And knowing that they got what they wanted out of life, even when it means not choosing to treat certain diseases, probably are the best days. Sometimes, I don't know. It seems terrible, but for some people, especially like with end-stage cancer and otherwise, who no longer want to go through with all of the rigmarole, knowing that all they want out of life is to spend more time, quality time with friends and family. Helping them achieve that goal has probably been some of my best days, knowing that it was the hardest decision for them and their family. I think one of the greatest strengths is the fact that we are a multidisciplinary clinic and there's so many specialties under one roof. We have the ability to see a patient, diagnose them, and sometimes get them treatment that same day. I joked I worked at Earl K. Long previously, and sometimes it was difficult to move people within subspecialties because you only had clinics on certain times of the week. And here I saw one patient, had them diagnosed with gallstones and had their gallbladder taken out all within the same day when it was causing them problems. And that was easy and convenient for the patient, and she was definitely appreciative of the pain being gone. So I think that's probably the biggest benefit.